Welcome back. Here is a challenging microbiology case for you. Watch closely, think critically, and see if you can identify the agent. Pay attention to the clinical signs, morphology of the organism in gram staining, and various biochemical tests. They hold the clues. Let's analyze this case carefully, just like we would in a diagnostic laboratory. A sheep was present with chronic abscesses in the superficial lymph node. You can see in this picture. When you hear this, one disease should already come in mind. Which one is that? Yes, it's caseous lymphadenitis, a classic condition in small ruminants. Now we move to the laboratory findings. The microscopy shows gram-positive pleomorphic rods arranged in a distinctive pattern, that is Chinese letter arrangement. So you can see that arrangement in this picture. It is gram-positive. This morphology is highly characteristic and immediately points us towards the genus Corynebacterium. But morphology alone is not enough. We need confirmation. Let's go through the biochemical profile. The organism is catalase positive. In this picture, you can see bubbling. So it is catalase positive. This tells us it can break down hydrogen peroxides, which help narrow down the other gram-positive rods, but still include multiple possibility. Next is urease positive. So here you can see urease test positive by the pink color. This is an important clue because Corynebacterium pseudotuberculosis produces urease, helping distinguish it from several other organisms. Now comes a key differentiating feature. The organism is non-motile. This is critical because one of our close differential, that Listeria monocytogenes, is motile, especially at room temperature, showing a characteristic tumbling movement. So this finding helps us rule out Listeria. Then again it shows a positive reverse CAM test. This is highly specific laboratory test where the organism enhances the hemolysis of the Staph aureus. This reaction strongly supports the diagnosis of Corynebacterium pseudotuberculosis. So our answer is Corynebacterium pseudotuberculosis. Now systematically we will eliminate the other options. First one is Listeria monocytogenes. Although it is gram-positive, it appears as a short rod, not pleomorphic, and most importantly, it is motile, so it doesn't fit. So we can cut this out. Next is Mycobacterium avium. It would be acid fast due to its mycolic acid-rich cell wall and would not appear as Chinese letter formation. So we can exclude that also. And the third one, Nocardia species are branching filamentous bacteria and are partially acid fast, which again does not match our findings. So when we put everything together, sheep with lymph node abscess, gram-positive pleomorphic rods with Chinese letter arrangement, catalase positive, urease positive, reverse CAM, non-motile, it all point towards the organism. Which one is that? It is Corynebacterium pseudotuberculosis. Actually, this bacterium produces phospholipase D-toxin, which promotes spread through lymphatics and lead to the formation of these characteristic caseous abscesses. Thanks for watching.